Roux-en-Y gastric bypass was described by Dr. Mason in the late 1970s. Dr. Mason practiced and still does in Iowa. The laparoscopic gastric bypass was described and started its way through the surgical procedure in 1993. And basically it became a gold standard for surgical treatment of morbid obesity. We started the Morristown Memorial Hospital program and did our first cases in 1999.
And so you do them very frequently here. I mean, that's what I've been told.
Right. We do the laparoscopic gastric bypass approximately 20 times a week here. We do usually about 7 to 8 a day. We don't operate every day. We do office hours in between.
They give you a day off?
Right.
Can you talk about the reasons why you perform this procedure?
Patients who qualify and need that operation done are the patients who usually tried everything else. This procedure is an end road or a last resort for the patients who suffer from morbid obesity. They tried every possible medical supervised weight loss program, and usually statistically 90% of people fail medical supervised weight loss program. Therefore, at the end of that, they resort to surgery. It's not a first choice. It's the last resort to give their life back.
But it seems to be really successful. I just spoke with 2 former patients, and their lives have been changed.
Those patients who tried everything else and researched the surgical option usually are very successful because they understand the risks, they also understand the benefits, and they want to make it work. Therefore, every patient which comes through our comprehensive program having proven failure of medical weight loss attempt. And after that, they are very successful with surgical limb. We would not take the patients, so to speak, just from the street because they researched and they want to have it done.
Okay. Can you sort of compare and contrast the procedure with any other, alternatives to this?
Other surgical procedures which are available.
Mm-hmm.
Of course, we specialize in laparoscopic operation. For all technical purposes, the same operation on the inside is an open gastric bypass. We believe that doing it laparoscopically minimizes the pain, allows patients faster recovery. Therefore, really, you can compare it to open gastric bypass, but for same technical purposes, same operation. Other procedures which are available in the United States are laparoscopic adjustable gastric banding, which we also prefer to do gastric bypass. We do gastric banding for selected very well picked up patients who are smaller, so to speak, very motivated, younger, which want something less invasive in the sense of non-permanent, so to speak, but yet want the benefit of weight loss. The other procedure in the United States is biliary pancreatic diversion, which we don't perform here because it requires much more rigorous metabolic follow-up, which currently we don't have available in our institution.
Okay. As far as the open gastric bypass, how long does that take versus, I mean, this took 45 minutes.
Well, it all depends also on the surgical technique. There are surgeons who do laparoscopic gastric bypass in several hours. There are surgeons who do open gastric bypass in about an hour or two. So I think time-wise, this operation, either laparoscopic or open, is very comparable to each other. It's a matter of which route or which entry point surgeon uses.
Mm-hmm. Okay. Can you talk about, I mean, we touched on this in the first question, but can you just talk about the benefits of the procedure for the patients?
Let's give an example. For instance, a patient who typically has a body mass index of 40 or above, or about 100 pounds above their ideal body weight, will qualify for the operation. Usually those patients will have diabetes mellitus or possibly will have diabetes mellitus, high blood pressure, sleep apnea, degenerative joint disease, arthritis, and possible other medical problems. By having that operation, by reducing their weight by 100 pounds, usually by a year after surgery, most of them become non-diabetic, sleep apnea goes away, aches and pains and arthritis goes away, and blood pressure, if not goes away, but gets manageable with either less medications or off medications altogether. So that's basically why I like to do this operation, because I'm giving the patients their normal life back. Younger females who have not been able to conceive can potentially have children, and we had happy children being born from families who've not been pregnant before the operation. So this is a tremendous life-changing operation.
Really, it's amazing. Can you talk about any of the complications or concerns from the patients regarding the procedure?
The mortality from this operation, all comers in the United States, is statistics are about 0.5%, or every 1 of 200 patients potentially may not make it out of the hospital. And the complications which will potentially are deadly and cause that are leak from the opening where the anastomosis in the stomach and the small bowel is, or pulmonary embolism. Any other complication is not considered to be deadly and will be potentially can be overcome with various other options. But if a leak from anastomosis is not recognized, patient can have peritonitis and die, or if the clot forms in the legs and shoots to the pulmonary artery in the lungs and oxygen exchange cannot take place. Obviously that can be deadly as well. Other complications, which is a narrowing between the in the opening between the stomach and the small bowel, can happen. The anemia can happen after surgery. Calcium deficiency can happen. Vitamin deficiency can happen. So we explain that to the patient in a very comprehensive way. We follow the patients up for the rest of their life. Every 3 months they come to our office. Every 3 months they have blood work done, checking for those problems. And therefore patients understand they're kind of getting married to us, so we get married to them. And we have to make that marriage work, because if you don't, it's not worth to have the risky operation.
Can you talk about the hospital's experience with this procedure? And can you say Morristown Memorial in your answer?
We primarily perform that operation at the present time from Morristown Memorial Hospital. We've been doing it since 1999. There have been more and more hospitals kind of jumping on the bandwagon, understanding that since the obesity is an epidemic in this country, and 30 million Americans are considered morbidly obese, or 50% of people are obese in this society by some statistics, that hospitals have to offer this operation because nothing else works. So Morristown has been a pioneer in the field of surgery. We've done the first laparoscopic cholecystectomy here in 1991 when gallbladders just came around as a laparoscopic approach. So when we heard that laparoscopic gastric bypass is available to the patients, we got trained in 1998, and we felt that it was very important to offer it to the patients and the community. The hospital was very supportive all along, gave us everything we need. We just had to basically get good at that, and that brings usually the patients from not just from our Morris County area, but actually even from outside of the state when patients search for surgeons with expertise in the field.
You must be doing something right, because it sounds like you guys are really, really busy. Okay, she's done. Can you talk about the devices and techniques that make this procedure a treatment of choice?
Clearly, as you watched the operation, you cannot do this operation just with a good old-fashioned sharp scalpel and a suture. You need to have special instruments which are made by various companies, and we use special staplers which allow through 5 little incisions to gain access to the abdomen of patient who is sometimes 500 pounds, and do all the division of the bowel and rehooking of the bowel and suture with the special instruments, and then hook the small bowel to the stomach as well, and then make sure it doesn't bleed, it doesn't leak. And this is all became possible because of the advancements in technology. And obviously we rely heavily on very good visualization from cameras which have very high resolution as well. So just our desire to do it is not enough. It has to have a support, and all the equipment has to be available and ready to work over and over and over again.
Great. And talk about the reasons why physicians should refer their patients to this hospital for the procedure.
Well, I wish I can say that I think that's the only place they need to send the patients. But I think when physicians who are family practitioners, obstetricians, gynecologists, internal medicine, pediatricians, unfortunately, are facing that problem with the children now. When they look what to do with the patient, I think they need to look at nowadays on the track record of the program. And when we were in 1999 starting, I was looking for my first patient. And of course, somebody has to be the first. Now the rules of the engagement have changed, because now everybody is very educated. Patients look for the surgeons of the program who has multi-disciplinary approach, who has been doing it for many years and has good results. So really, it's not because we want them to send them here, but since we've been in the game early enough and been successful identifying what the key entry points are to minimize the complications, we're proud and we truly believe that we have one of the best programs, if not in the state or maybe beyond the state even. And that'll be the reason. And the reason why the patients should be sent to a surgeon versus continue with the diets and exercise, as I mentioned earlier, is because diets and exercise alone carry 90 to 95% 5-year failure rate.
Which really blows my mind. Wait for it to start. Can you just say that again? That a diet and
Diets and exercise alone statistically carry 90 to 95% 5-year failure rate to accomplish goals of weight loss. So therefore, it's not that you shouldn't try the diets, but we unfortunately know the outcome if you take all comers in 5 years is going to be as I described.
Right.
Surgery carries the opposite, 80 to 90% success rate in 15 years. The gastric bypass has been studied for 15 years of success of losing weight and keeping it off.
Really?
So it's the opposite curve. So this is why it's worth pursuing it, because if you make it work, you're set for the rest of your life.